All right, so the last system that we're gonna look at is the skeletal system. Our foot problems could also be coming from a bone source or a joint source. So meaning, again, like what I gave you guys as an example earlier, it could be coming from a fracture. That's why you feel pain, or it could be coming from a joint arthritis, and it mimics as PF. With this one, guys, with skeletal source as the pain, so more often than not, there's no first step pain in the morning, but the symptoms are somehow almost the same. All right, now let's dive into it. So there are 3 diagnoses that we're gonna look at right now. So one is calcaneal fracture. So if you have fracture on your calcaneum or on your heel bone, you will feel extreme pain. It's basically it. It won't stop even though you don't put weight on it. So even though you just hang your foot there, you experience pain. You will also feel extreme pain at night. So that's also one of the classical signs of a fracture. You actually won't dare to put weight on that foot because you know how painful it will be. If you have a fracture, that's what it looks like compared to PF, in which you will still try to walk, but you're gonna be on your toes. You're gonna be toe walking, but still you can tolerate weight on your foot. With fracture, you won't even dare to place weight or put weight on that foot. Also night pains. But then again, if you suspect this, if you have these types of symptoms, go to ER right away and request an x-ray, or go to an orthopedic doctor for them to have it checked if what you're having is a fracture rather than PF. For these types of scenarios also, or cases, there's a trauma that happened. So there's an accident that could create that break on the bone. That's why you will feel pain. But the area where it hurts, it's directly on your heel part. So it looks like PF, but it's actually not. Now, the way also to differentiate it is with the type of pain that you experience. So if it's a deep nagging pain, it might be that the pain that you feel is coming from your bones. So you have to check. You need secondary ancillary procedures like x-ray for you to confirm if what you have is actually a fracture and not PF. Also, guys, if it's a bone issue, the pain that you feel, it will be very tender to touch, especially if it's a fracture. So the pain that you feel is very tender and it's kind of extreme, way different than a soft tissue or muscle problem or a neurological pain. So it's an extreme pain. One small touch could create massive pain, and it's a deep one. So you will really feel it deep and extreme, dull, boring, nagging pain deep inside your foot. The next one we're gonna look at is what we call subtalar arthritis. The symptoms, that the area where you will feel the pain if you have this type of arthritis or subtalar arthritis is also on the heel part, in between your ankle and heel. It's also a massive pain. So whenever you bear weight on your foot, you will also feel that pain on your heel if you have subtalar arthritis. Okay, so this one usually happens after a trauma or a fracture. Unfortunately, the way for you to know whether you have it or not is for you to have your body checked and have an x-ray. So I'll show you an image on what it looks like. What happens is there's degeneration on the cartilage of that joint. That's why it's causing you pain. So there's bone-to-bone contact between your talus and your calcaneum, which forms your subtalar joint. So there's bone-to-bone contact there, and it creates also a massive pain on your heel whenever you try to put weight on it. You can treat it conservatively by doing some exercises on the foot, improving the posture of your foot, but the exercises will only work to some degree. It will not actually fix the problem. There's actually no 100% cure yet for this type of problem or for this type of diagnosis. Although there are some surgeries now available, so there's subtalar fusion surgeries, which helps improve the contact on that joint. But I am not 100% sure what the outcomes are with regards to the patients who've done it. Now, there are also a big demographic or big population of people who have it, but they can live with the pain also through medication, they can actually live with the pain and actually opted not to do surgery, and they just decided to live with the pain. Exercises can help this type of demographic, but then again, I cannot assure that you can reverse it or there's gonna be absolutely zero pain in a day. That's what's really unfortunate if you have this type of case or this type of problem. Okay, so the last part on the skeletal system as the source of pain or foot pain is something that occurs in children. So if you're not a child watching this video, so you might not actually have this one, but probably growing up you experience it if you have foot pain right now. So it is what we call Sever's disease. What happens is the attachment of that Achilles tendon on the back part of the heel pulls on the growth plate of that calcaneum or heel bone, and thus it also creates pain on the back part of your ankle, much like a retrocalcaneal bursitis. So the way to actually differentiate it from PF is very simple. Again, it's with the location of the pain. If it's from the back part of your heel, you would think of retrocalcaneal bursitis or Sever's disease. That's one. And then second is the absence of the first step pain in the morning. Now, the way for us to basically treat it is, number one, to let the inflammation subside and control it by using ice or some other modalities that can decrease, or medications that can decrease inflammation. And then second is you have to train the calf muscle to work on an eccentric manner, so much like the treatment or the exercise for Achilles tendinopathy. So you would have to work on that, plus also improving the foot posture. So meaning if you're overly pronated, we have to do some exercises to correct that. If you're overly supinated, we do the reverse of that exercises. Also, you have to improve the mobility of your ankle and for you to completely alleviate the pain and the problem that you feel if you have a Sever's disease.